Your child's just been diagnosed with scoliosis. You may have heard wait and see, but time does matter. You're overwhelmed and you're searching non-stop. You just want to do the right thing fast. Hi, I'm Mirenzi. I'm a physical therapist and Chief of Research and Communications here at ScoliCare. I've spent many years helping families like yours navigate this exact moment when every decision counts. In this video, I'll walk you through the 3 most important steps to take now, so your child gets specific non-surgical care before options narrow. The hardest part of childhood scoliosis is that most parents don't realize how fast scoliosis can change, especially during growth spurts. I've seen families told to come back in 6 months only to return with a curve that's doubled. At that point, non-surgical options may no longer be enough. That's when surgery becomes the next conversation. But it doesn't have to go that way. The problem isn't just the diagnosis. It's the delay, the missed window, the lack of clear guidance when it matters most. So let's change that. But you might be wondering, why does early action matter? Why do you have to act so quickly? Let me give you an example. A mother brought her 3-year-old daughter to us after noticing a visible shift in her posture. She'd already seen a family doctor and an orthopedic surgeon. The child had been diagnosed with infantile scoliosis, and her curve measured 40 degrees. She'd been fitted with a hospital-made brace, but even in the brace, the curve was still 33 degrees. They then came to ScoliCare for a second opinion. We prescribed a custom 3D scoliosis brace designed specifically for her body and curve. In brace, we saw full correction, and over the next 2 years, her curve reduced from 40 degrees to just 14 degrees, without surgery or casting. That outcome wasn't luck, it was early action with the right tools. That case didn't just turn out well by chance. It worked because the parents acted quickly. Because the brace designed was specifically for that child and not pulled off a shelf. And because the treatment wasn't wait and see, it was proactive. So why do these details matter? Especially right after a scoliosis diagnosis. When it comes to scoliosis, especially in growing children, time is everything. Final curves often progress rapidly during growth spurts. So what looks like a mild curve today can become a surgical case in just a few months if left unmanaged. That's why early intervention matters. But it's not just about acting fast, it's about acting wisely. Not all braces are created equal. Some braces just hold the spine in place, but others like ours aim to guide it towards correction. A generic one-size-fits-all approach may provide partial correction, but partial isn't always enough. In many cases, it allows the curve to keep progressing, just more slowly. What makes a difference is the brace designed for your child's spine, a 3D overcorrective brace that actively guides the spine towards a more neutral alignment, not just holds the spine in place. And when you combine that with movement therapy and regular monitoring by a trained scoliosis provider, you're giving your child the best chance at avoiding surgery and thriving in their body. This is the kind of care that most parents don't even know exists, but it does, and the earlier you begin, the more options you'll have. So, if your child has just been diagnosed, what should you actually do with this information? It's one thing to understand why early care matters, but it's another to know where to begin. Let me walk you through the first most important steps you can take right now to get your child on the right path. Step 1, get a second opinion from a scoliosis-trained provider. Even if you've already seen a family doctor or a specialist, it's important to connect with someone who focuses specifically on scoliosis, especially non-surgical treatment. They'll be able to assess not just the curve, but also posture, flexibility, and growth stage. These details are critical. Step 2, ask about custom 3D bracing. If bracing is recommended, make sure it's not a generic design. A 3D overcorrective brace like the ones at ScoliCare are built to work with your child's unique curve, pattern, posture, and body. It's not about holding the spine in place, it's about guiding it towards a better position. Step 3, support the brace with scoliosis-specific rehab. Gentle guided movement can help improve muscle balance, postural awareness, and long-term outcomes. Even at a young age, a simple home-based program can make a difference. And finally, start now. The sooner you begin, the more options you have. This isn't wait and see. This is a window of opportunity. Since you're ready to start now, check the links in the description below. We've included resources for getting a second opinion, understanding scoliosis bracing, and recommended rehab options. If your child has scoliosis, those first few steps aren't just helpful, they're pivotal. Those steps can change everything from preventing progression to avoiding surgery. When your child is first diagnosed with scoliosis, it's easy to feel uncertain, even afraid, but the truth is there is something you can do. And when you act early, with the right guidance, you open the door to real non-surgical results. That's it for now, but there are many other resources on the channel for you to check out if you would like to. I'm Mirenzi, and from all of us here at ScoliCare, thanks for watching.